Hey, I'm Chris Peterson. Welcome to Checkup Prep, your informational video series based on your child's well visit. Probably not a conversation we should be having here at the library. So let's do this. You watch the disclaimer clip, I'll meet you back at the office. Perfect. See you there. While I am a board-certified pediatrician licensed to practice medicine in the state of New Hampshire, this video is meant to be informational only, not an attempt to practice medicine, nor to be diagnostic. It is meant to be used in conjunction with your child's well care visits.
Hey, welcome to your 6-month checkup prep visit. Let's start off talking about foods. If you're breastfeeding your baby, we'd expect you to be nursing 5 to 6 times a day. Maybe getting up still once a night between 2 and 4 o'clock in the morning to feed. Still give your baby a vitamin D supplement. That's going to be important for bone health later down the line. And now, at 6 months of age, we can start your baby on some solid foods. So take some infant cereal, take some breast milk, some express breast milk, or some water, and mix it up so that it's not lumpy, not runny, something you can get up on a spoon, and give your baby the food. At first, it's going to tongue thrust it back out at you, because everything it's had thus far has been liquid. And so slowly giving that solid food will help decrease that gag reflex, and your baby will take it, and boy, will it take it. We're going to get to about a half a cup a day of infant cereal. You can divide that through the day. You can use quarter cup maybe in the morning, quarter cup in the evening, and maybe once we start stage 1 foods, you can give just stage 1 foods at lunchtime. But starting off just with that cereal, bookends of the day, and once it's doing well with that quarter cup, then we can start in some finely pureed foods. So stage 1 foods are, again, finely pureed if you're making them yourself. Give that along with the infant cereal at your bookends, breakfast and dinner, and then just finely pureeds at lunchtime. Don't worry about giving too much. Your baby will let you know. Just watch him. She'll push it away, or she'll close her mouth, or he'll turn his head and say, no, I don't want any more. So just watch your baby, and it'll let you know how much to give. If you're formula feeding, it's about 24 to 32 ounces a day. Again, a half a cup of infant cereal every day, in stage 1, moving towards stage 2 foods. For both breastfed and for formula-fed babies, choking is still a risk. And as we increase the solid content of that food, that risk does increase. So watch your baby when you're feeding. Don't bottle prop, don't walk away. Make sure you're there with your infant when you're feeding it. Let's talk about development. So at 6 months of age, your baby should be making sounds, cooing, blowing raspberries, clicking, coughing sometimes. Yeah, hi, it's the baby. Bringing you in using its verbal cues. Those are the things that we're going to be looking for verbally. Gross motor, your baby should be able to sit well for just a little bit. So you sit them up, and then they'll do this slow forward kind of fall, or they'll lean in, fall over one way or the other. So sitting with some support, but being able to sit. They'll also enjoy leaning into things like exercisers, so they can stand, lean into it, play with the toys in front in an exerciser. Also, rolling both ways from a gross motor standpoint. So your baby should be able to go back to front, front to back. This is a way for them to get around. This is mobility. So your baby will be able to roll and get across the room. With those hands reaching out and grabbing things, passing from back and forth is the fine motor goal for 6 months of age. The two of those in combination really increase your risk for your baby around the house. So making sure that the toys and things they can pull down on themselves and all of those safety risks that we'll talk about in a second are mitigated around the home. With mobility, certainly we see that increase, that risk increase around the house. From a social standpoint, your baby should be able to do some self-comforting now. I'm not saying you can leave your baby, for hours at a time, but you should be able to leave your baby for a little bit, go do some cooking, go to the bathroom, those kinds of things. Still supervised. Again, don't leave your baby alone because there's a risk there, but he or she should be able to do some self-comforting around 6 months of age. Teeth. Your baby may have teeth. Somewhere between 6 and 10 months of age is where they break through. So once they do come through, brush them. Get a little toothbrush, put some warm water on it, get in there and brush those teeth up, trying to clean them up the best we can. Also, check out fluoride. If you have municipal water, you're going to want to call your municipal water supplier and see if they add fluoride. If they don't, then you may want to talk to your provider to see if we can get a fluoride prescription. If you have well water, some wells have natural fluoride in them, so you'll want to check your home well water test to see if they tested for fluoride, and if they haven't, you can test for fluoride, send off a water sample, test for fluoride, see if your baby's getting it. If you're getting enough through your water supply, we don't need to worry about a supplement. If you're not, then a supplement may be a reasonable thing to think about to keep your baby's teeth healthy. Other things to keep good teeth, not bottle propping, not sending your baby off with a bottle even of water at nighttime, because that will rot the front teeth with all those sugars that will be there on the teeth through the night. And so we definitely don't want to send your baby off to bed with a bottle, and we don't want a bottle prop trying to keep those teeth as healthy as we can. Safety. Now with, like we talked about, that mobility coming up, we really need to think about things around the house. Outlets, cords, window guards, or opening the windows from the top. Finding cabinets that need to be locked up and stairs that'll need to be gated. Limiting the access to bathrooms and to water-filled containers. Securing poisons, matches, medicines, weapons around the home. Your baby is going to be everywhere soon enough. Gates, like I said, top of the stair and bottom of the stair. The little things, plastic caps and siblings' toys, making sure they're not accessible. Making sure we really are trying to be proactive about that child-proofing. Again, smoke detectors, carbon monoxide detectors, making sure those are working. Making sure we're avoiding secondhand smoke. I'll say it again, if you smoke, please quit. Not only for your own health, but for your baby's health. And we know that babies are watching and they're going to model. And so if they see somebody like their parent, the most cool person in their whole wide world smoking, they're more likely to smoke later in life. So now's the time to quit if we can. I know it's hard. I'm not judging. Don't get me wrong. But if you can, let's try to get that done now, not only for you, but for your baby. Other risks, the hot beverage risk, still that pull-down risk. The coffee cup where he pulls it down, she gets a scald injury all over the whole body. So avoiding that. Cigarettes, small objects, plastic bags are all risks for your baby as well. Avoid excessive sun exposure. We don't want your baby out in the sun. However, now sunscreen is okay. So we still don't want to slather your child up with sunscreen and go off to the beach. But if you know you're going to be outside and your baby's going to be exposed to the sun, sunscreen is okay to use. Talk to your pediatrician or your medical provider about SPF and what's the right type of sunscreen. But sunscreen is okay, as is bug spray. However, once again, we want to try to avoid bugs, not using bug spray if we don't have to. So trying to stay inside during those times of the day, morning and in the evening, when the bugs are really out and can get to your baby. Walkers. So walkers are nice from a mobility standpoint, but they're dangerous. So I don't recommend kids in walkers. Exercisers, different story. Can't move it around, can still play. But being able to get around and access things even more increases your risk around the home. Going downstairs, scooting over, getting something off of a cabinet or off a coffee table, it just increases your child's risk. So I don't recommend walkers. If somebody gives you one, kindly say no thank you. And certainly don't go out and buy one yourself. Use your money for maybe an exerciser or something that's stationary. SID safety, still a risk. Still on your back to sleep, still an approved mattress with nothing in the sleep space, no bumpers, no blankets, no pillows, no stuffed animals. We want no smokers around the baby, and we still want that baby in the room. Academy of Pediatrics says up till 6 months of age, maybe even 12 months of age, in your bedroom. I know, it's hard to sleep with your baby and in the room, and getting rest for you is important, but maybe putting your baby down before you go to sleep and then coming in to sleep yourselves later is a reasonable strategy. Still no co-sleeping. I know it's easy to do, bringing that baby into your own sleep space, sleeping together, but it dramatically increases your risk of SIDS. So we want to stay away from co-sleeping. And the final piece for safety is that car seat. Rear facing, 2 years of age, 5-point restraint. 35,000 Americans are killed every year in car crashes. So doing what you need to do to mitigate that risk for your children is important. And at 6 months of age, it's a rear-facing car seat, 5-point restraint, back seat being the safest spot. Let's talk about the things your baby's going to like to do. Activities, patty cake, peekaboo, playing with the toys, reading, singing. We do want to start setting some rules. I'm not saying timeouts, but I'm saying we don't pull hair and moving that hand away. No, we don't pull, that hurts mommy's hair, that hurts daddy's mustache, what have you. So starting to set some boundaries around the house. Again, no timeouts, just really using distraction. And I wouldn't be overly stern. Read with your baby, exploring smells and touches, kissing, cuddling, hugging, snuggling, interacting. Now that your baby is doing all this talking and clicking, give them more things for them to imitate. They want you to be in their world. That's why they're coughing and clicking. You're doing the dishes, what have you, you hear, you look over, you get that big smile. They want you there. So take advantage of that. You're the coolest person in the whole wide world to that baby, and you will be for another, I don't know, probably 9 years. So take advantage of that role because it does go away, unfortunately. For you, make sure you're still taking time for yourself. Make sure you're able to get out, do the things that you want to do. Still paying attention to your baby. I'm not saying don't do that, but I'm saying make sure you're taking time for you and your spouse, keeping that relationship fresh as well. Still with that calm, anxiety-free face, making sure we're interacting with the world in a nice, calm, easy way. Your baby is watching you and mimicking you in a lot of ways that we can't see yet because it can't physically show us. But I just want you to reflect on how you deal with anger, frustration. Are you respectful? Are you polite? How do you drive? Are you yelling and screaming? How do you resolve conflict between your spouse and yourself? How do you deal with frustration? All of these things are things your baby will be watching very soon to see how you deal with them and will then mimic them. And so making sure we're doing the right things. If you stomp your foot every time you get angry, your baby's going to stomp your foot. You throw something every time you get angry, your baby's going to throw something. That's coming. So making sure we're looking at what we're doing because we're the view of your baby. You're painting the landscape for your baby to see. So make sure it's a nice, calm, respectful, polite, kind world, and that's what you'll get for a baby. It's as easy as that. I hope you enjoyed your checkup prep visit. We'll see you next time. Take care. Enjoy your baby. Stay balanced and centered.